Is chocolate bad for your skin? How about makeup? Can you get acne at any age? Today we're busting some of the most popular skincare myths. Stay tuned until the end for some surprising skincare tips and tricks that could revolutionize your daily skincare routine. Fact or fiction? Eating chocolate is bad for your skin. Fiction. Chocolate alone is not necessarily bad for your skin, despite its association with acne. Milk chocolate and white chocolate can contain high levels of dairy and sugar. Dairy and sugar can contribute to acne, but the association is very complicated and not entirely understood. Current thought is that sugar can worsen inflammation and dairy can increase insulin-like growth factor and androgens, leading to more oil production. Chocolate, including dark chocolate, has been associated with breakouts in acne-prone patients, but causation, even if there is any, has not been established. Fact or fiction? Getting a tan is healthy. Fiction. A real suntan is never healthy, despite the association with a fit lifestyle. How do you get a tan? UVA oxidizes melanin, causing it to darken, and UVB increases the production of melanin. A tan is the skin's response to UV damage. If you are tanning, you are damaging your skin, and a tan does not offer significant protection against UVA and UVB damage. Tanning increases your risk of skin cancer significantly. Fact or fiction? Popping pimples is bad for you. Fact. Despite how tempting it could be, you should avoid popping pimples. It pushes bacteria into the skin, making things worse. It can cause inflammation, and it can lead to infection and permanent scarring. Dermatologists may sometimes perform extractions for blackheads and whiteheads if they're resistant to other treatments, but this would then at least be done in a more controlled environment. Fact or fiction? Touching toads or frogs causes warts. Fiction. This myth has been around for a long time and is probably related to the fact that many frogs and toads have warty looking bumps on their skin. Warts are caused by the human papilloma virus, or HPV, and there are well over 100 different types of HPV. You catch it from contact with people and surfaces they've touched, not frogs or toads. And the virus causes an overgrowth of keratin in the skin, leading to the formation of a wart. There are many different treatments available, including high concentrations of salicylic acid to peel the layers of the wart, and cryotherapy with liquid nitrogen. Fact or fiction? Using toothpaste on your face will help with your acne. Fiction. Toothpaste will not help pimples, and it can actually make things worse. Where does this myth originate? Many toothpaste formulas used to include triclosan that could kill the bacteria that causes and worsens breakouts. Some ingredients commonly found in toothpaste, such as baking soda, hydrogen peroxide, and alcohol, were traditionally used to dry out pimples. Toothpaste also includes spearmint and menthol oils, commonly which can cool the skin, though they can also irritate and inflame the skin, potentially making the acne worse. Toothpaste also tends to have a basic pH, which tends to irritate skin. Fact or fiction? There's no difference in using SPF 15 versus SPF 50 sunscreen. Fiction. SPF refers to protection from UVB rays, the sun's burning rays. An SPF number tells us how long it takes for your skin to redden with sun exposure. For example, SPF 15 means that it takes you 15 times longer to burn in the sun compared to no sunscreen protection at all. And SPF 50 means 50 times longer. SPF 15 blocks about 93% of the sun's UVB rays, whereas SPF 50 blocks 98%. However, it's good to note that a higher SPF can give a false sense of security. High SPF sunscreen still needs to be reapplied regularly, about every 2 hours, especially after swimming and or sweating. And make sure to get broad spectrum sunscreens that help protect against UVA rays as well. Fact or fiction? Acne is genetic. Well, it's complicated. Acne can be genetic or influenced by genetics, but there is no one gene that makes you experience acne breakouts. Research does show that genetics impact your chances of experiencing acne. This is particularly true when acne is caused by hormonal conditions that have a genetic component, such as PCOS. Your genetics can also influence how well you ward off the bacteria, P. acnes, which causes inflammation and can trigger oil production, stimulating acne. Environment, diet, stress, and hormonal fluctuations can all play a role. Fact or fiction? Washing with hot water is good for your skin. Fiction. Long and continuous water exposure damages the skin barrier function, with hot water being even more harmful. Transepidermal water loss is higher after hot water exposure than with lukewarm or cold water. Hot water has the potential to dry out and irritate your skin, and it can make the skin more sensitive. Fact or fiction? Facial exercises will reduce wrinkles and the aging process. Fiction. Muscles in the face form a complex web that attach to bone, each other, and the skin. Skin is elastic and provides little resistance, so working out dynamic facial muscles stretches and wrinkles the skin. That's why botulinum toxin or Botox is so effective at reducing wrinkles. It stops the muscles from moving. This myth likely originated from the idea that regular exercise reduces inflammation, helps build muscle, and all the things associated with anti-aging of the body overall. I did a video on face gym workouts in the past, so make sure to check out that video if you're curious. Fact or fiction? Makeup is bad for your skin. It's complicated. Most people who use makeup don't find that it makes their skin worse. But according to the American Academy of Dermatology, makeup can cause a type of acne called acne cosmetica, which are many tiny bumps all over the skin, and they frequently appear on the cheeks, the chin, and the forehead. Makeup can also potentially aggravate existing skin conditions. It is recommended that you remove all makeup before bed, that you're gentle when applying it so as not to irritate the skin, and that you use clean tools regularly. Fact or fiction? You should only wear sunscreen on sunny days. Fiction. You should be wearing sunscreen every day. On a cloudy day, over 90% of UV rays still reach the Earth's surface. Remember that UV rays are invisible. Cloud cover reduces visible light much more than it does UV. Fact or fiction? Skin tags are dangerous and must be removed. Fiction. Skin tags are benign tumors of the skin and are harmless. They are soft overgrowths of skin that often occur in high friction areas and in skin folds, such as the eyelids, armpits, groin, neck, and other areas. They often sit on a stalk and can sometimes rub or fall off. If it's in a high friction area and it's leading to discomfort, irritation, inflammation, or infection, then it can be removed. But the removal is mostly for cosmetic reasons. Fact or fiction? Excessive sweating causes acne. Fact. According to the American Academy of Dermatology, yes, sweat can cause acne. Sweating is a healthy way to release buildup and impurities from the skin, but it can clog pores. Sweat also creates a warm, moist environment in which yeast can thrive, leading to seborrheic dermatitis or dandruff, especially if you're already prone to this condition. But don't skip your workouts. Remove makeup before exercising and shower afterwards. Fact or fiction? Getting a spray tan protects your skin from sunburn. Fiction. A spray tan offers zero sun protection. The color from a spray tan is caused by a chemical reaction between the proteins in the upper layer of the skin and the sugars in dihydroxyacetone or DHA, the chemical responsible for giving your skin a fake tan. The result is that the affected proteins take on a rusty brown shade that won't wash off. These altered brown proteins, unlike melanin, offer no sun protection. Fact or fiction? You are not born with freckles. Fact. No one is born with freckles. Freckles are extra patches of pigment under the skin dictated by genetics. Freckles develop during early childhood, often triggered by sun exposure. They can fade in the winter and sometimes disappear in early adulthood, but you can continue getting more freckles into your early 20s. They are most common in people with light coloring, but can occur on any skin color. Fact or fiction? Wearing sunscreen indoors is pointless. Fiction. UVA and UVB rays do penetrate glass, so if you work near a window, sunscreen on exposed skin is a good idea. This also goes for driving. Even if your exposure is short, such as walking to and from your car, the effects from sun damage is cumulative. Lotion or moisturizer is only for women. Fiction. Moisturizer can be beneficial for men and women. Moisturizer can be useful for treating dry, flaky, and cracked skin and can help protect the skin barrier. Using a facial moisturizer shouldn't take away from your masculinity. This is why we designed our facial moisturizer on feelconfident.com to be gender neutral as far as its smell and as far as its packaging goes. Head over there and sign up for the newsletter to know when the latest products drop. Fact or fiction? People at any age can get acne. Fact. People of all ages get acne. Acne is highly associated with hormonal changes. Puberty, pregnancy, and menopause can all correlate with acne. And you can get acne later in life even if you've never had it as a teenager. In fact, adult acne is on the rise. For women, it's increased 10% worldwide over the last decade. Newer medications are available that can better treat hormonal acne, including spironolactone, which we happen to use for hair loss in women as well. For more information on women's hair loss, make sure to check out our dedicated video on that topic. As you can see, there are a lot of myths out there that just aren't true. You have to be very careful with where you get your information and make sure that you're staying safe and protect your skin.